Afternoon, everybody. I'm so happy to be here today, and it's a big pleasure to be talking to you in the next 40 minutes about the outsourcing transport in public health. I'll start by tell you a small story. In my village, there was this boy who had the ball. He was the owner of the ball. And we all rely on that ball to play. The funny thing is, the guy was not the best player, but because he owns the ball, we have to all please him. So in some situations, he fell down, and then he took the ball, and we stopped playing. So my role was to actually bridge this relationship between the owner of the ball and the team. So I had to talk to the team and say, guys, please, let's make sure we pass the ball to this guy. We know he doesn't play well, but he owns the ball. And I talked to the owner of the ball, please understand, bring back the ball. We need to play. We'll now give you more the ball so you can play with us. This story, it's linked with the theme that I'm going to talk about, which is the bridge between private and public sector. So in this case, the public, the government being the owner of the ball. They own the ball, they own all the processes. They have this mandate to actually serve the people with many services that they need. But because they can't really fully do all the work, but they still own the ball. And VillageReach plays this role of bridging this relationship. And I've seen that word partnership being said several times by other presenters. So the partnership between government and private sector is key for success in this outsourcing of transport in public health. Next slide, please. I don't have the... VillageReach has been 20 years in the markets, giving support to the Ministry of Health. And in those, we identified one of the major goals, which is we'll be a global leader in radical collaboration. Why is that important? Why is private sector so important to sustain and scale equitable solutions? It's because governments really needs to use all the resources available in the private and for-profit so they can really sustain and can really drag this knowledge and technology from the private sector to innovate and ensure that the solutions are really kept and maintained and sustained to scale. Sorry. All right. So these are some of the private and public partnerships, examples, and areas that VillageReach operates. And we have the private sector technical assistance, where the companies will bring their technical assistant expertise to the public sector and actually support the solutions. We have where the private sector actually provides the services itself, and situations where the private sector just brings technology, all to ensure that the solutions are sustainable and scalable. Okay, private sector engagement covers a range of activities. All these are related and depends on which country you are trying to implement the solution. And then it starts from the national strategy, whereby we influence the strategy of the government itself to ensure that the private sector is captured into the strategy. Then we have also the private sector strategy, which we also sit with the private sector and see how they can actually ensure that the relationship between private and public sector is captured into their strategy. Number 3 is most where we operate, which is actually sitting with both and coming with the matching in terms of demand and supply. Then number 4 is solution definition and delivery, and in-country stakeholder management. All this is what we call a private sector range of activities that we implement. These are some examples, some practical examples that we implement. We have the Med 25 in Kenya, where the role of private sector is creation of new services and business. We work with private clinics and mortuary business to ensure that this service is delivered. And then we have the CCPF in Malawi, where the private sector access to subscribe-based provision of voice, airtime, cost, marketing, and expertise. And we have this services delivery in Mozambique, where we have Agility, Bolloré, delivering the service of distribution of health commodities up to the last mile. And I'm gonna talk more about this because this is the case study of Mozambique. It's an interesting case study because we started as a small, which took some time to actually convince both private and public sector to work together. And now we can consider this as a success story because it has been scaled and it's been funded and it's working. So now I'm gonna talk about the Outsourced Transport Resource Center. This lays out the journey on which the Outsourced Resource Center was created and developed. It's all started in 2015. The solution I was talking to you about, the transport of health commodities up to the last mile. So in 2015, we started in one small province. This was the first case of outsourcing in Mozambique, special for health commodities. As we all know, usually the Minister of Health is quite protective when it comes to give medicines to others to transport, and even worse when it comes to vaccines, because it requires cold chain and all those measures that are needed to move product from one place to another. So in 2015, we started with a direct contract with the transporters. We were starting with the process. I must say that all this process has been driven by the government with support from VillageReach. So the model itself was designed by the government with our support, not the other way around. So in 2015, we started this adventure in Tet province. And then in 2018, given good results, which we made an evaluation with Imperial Health Logistics. Actually, the consultant who came to do the assessment came from South Africa. And the results were good. I mean, we were coming from a situation where the government was doing its own distribution. As we all know that in sub-Saharan Africa, the quality of roads leads to broken vehicles, maintenance, it's all mess. So this came to actually resolve this problem. So after proved results, the government decided to expand in 2018, we went to another province. The good thing is that we realized that if we keep contracting transporters, it won't be scalable. Instead, we have to move from direct contract with transporters and we contract logistics service providers, which we call them 4PL. So that was tested in 2014, where Bolloré started working in the project. And they were contracting several transporters and managing them with key performance indicators already pre-chosen, and they were the only entity reporting back to the government. That was the scalable model, because we realized that this was going to go through the whole country. So if the government is managing 300 transporters, it's quite difficult to manage through all the process. In 2020, we scaled it up to more provinces, and we also introduced the second 4PL, agility. In 2021, we were in 6 provinces and 90% of the country. So in 2021, by the end almost, we were covering almost all the country when we actually transitioned this model to Shigar. Shigar is a mechanism. It's a USAID-funded mechanism. The model is the same. It's the transportation of health commodities and vaccines, including COVID vaccines, from the main hubs all the way through to the health facilities. So this mechanism of implementation started in July 2021, and we as VillageReach, we focus now on technical assistance, ensuring that everybody follows the procedures and ensure that everything is running smoothly. We have the key performance indicators measured monthly. We have meetings. We have action plans to improve all this process. So the Outsourced Resource Center comes to actually ensure, first of all, ensure that this model is well implemented in Mozambique, and then we want to take this experience to other countries. I must tell you that if we look at the supply chain of health commodities in sub-Saharan Africa, we'll get surprises. Just to give an idea, in Mozambique, we had like 15 channels of supply chain. So each commodity, each line of commodity has its own quantification process, from procurement, quantification, distribution, all the way. So you would see a vehicle leaving the same warehouse with just family planning goods, leaving ARVs and TB drugs, because the supply chain are different. So we still have those situations in Africa, and we want to ensure that the Outsourcing Resource Center actually gives support to these countries. First of all, to ensure that they put the outsourcing into their strategies, and second, to ensure that all this process is done in a systematic way. So the Outsourced Resource Center is a recent 1-year project, and we are going to partner with organizations in those countries and possibly also governments directly to give them the support so they can outsource their transportation of health commodities. We are going to act as a catalyst to partners and governments. We are not willing to have offices in all countries that we are going to give support. Instead, we expect partners that are already operating in that geography, in that country. They can actually get the high-quality technical assistance so they can implement the outsourcing in their countries. The type of support we give, it's in many forms. We support in terms of assessments, we do evaluations, and to support governments to decide on really outsourcing. I must say that through all this experience, through all these years, we developed toolkits where we kept all the learnings, all the processes, all the tools that we used are all kept in one toolkit. It's a cloud-based. So as we know, governments always rotate people. So we want to ensure that whoever comes in that position, by the way, I'm here with the folk from government and then the private sector from Mozambique. So we want to ensure that these people, when they are moved, they still have a Bible where they can still get information from and to ensure that the operation continues. How is the service being delivered? We have 4 major pillars. We have the advocacy. The advocacy lies especially on ensuring that the government understands the importance of outsourcing, both government and private sector. We know that there are a lot of concerns in the private sector side when it comes to work with governments. Not all of them, but in some of these countries, they are not good payers. They delay with payments. That's a big problem. So what we do is to actually advocate. What we are doing here is to advocate. We've been doing this quite a lot of webinars to ensure that people are getting this discussion of private and public partnerships. Then we do also strategy planning, where we sit with them, we analyze the market, we outsource, we ensure that the services that the government needs are well defined and well explained to the private sector so they can contribute. Because one of the things we realize is that, let's look at the bids that the government does. Usually they don't put a lot of details there, which makes difficult for private sector to actually respond to those. So we ensure that this process is all very well structured and very well detailed, and all the details are well upfront, so the private sector can actually have appetite to bid into this. Then we have the implementation and support. And at the end, we ensure that all the solutions we develop, they are transferred either to government, either to private sector. As I said in the journal I was presenting, after we ensure that the process was really running smoothly, we transition it to SHEGAR, which is a mechanism funded by USAID, where USAID contracts directly Bolloré, the 4PL. We get out of the game. We keep now the supporting, giving technical assistance, and our most focus now is to ensure that government teams are well capacitated to actually manage this outsourcing adventure. We know that not all the countries will be in the same position. Some of them will be in the explore, where they still want to understand the benefits of outsourcing. Some will be in the planning, some will be in the implementation, or we'll find countries where they are already implementing, they just need to optimize. Or even we are okay, everything is fine. We can also give support on the transition process. We have a very well-structured transition process which we tested, we improved, and we implemented in Mozambique, and it worked. We are not saying that everything that we tested there, it's going to be exactly what we are going to implement. The idea here is to actually sit with the teams in those countries and take those solution tools and reports and all those set of tools and actually adapt to the reality where we are going to give the support. How to engage with us? There are 4 major steps which we identified, but you see there are 6. So the first one is actually the express of interest. We will not go to a country where the government hasn't showed any interest on outsourcing, okay? And After a government showing interest, they need to also identify a partner that is going to support them. But who is going to actually support them, the implementation in country, as well as I said, we are not planning to have offices in all those countries. But we expect partners who has offices and who are already supporting that government to have the technical assistance by us, which is free, in a sense that we are going to pay for our tickets to go there. We are going to pay for all materials, training materials, but we are not going to pay for the transportation itself. We expect the governments and the partners operating in those countries to actually support those costs. Then we do the evaluation of the opportunity. Here we do those meetings. We sit with the interested parties. We discuss. If you remember the slide I presented, that's the number 3, where we actually evaluate the supply and the demand. So this is where we evaluate the opportunity to ensure that we have all the necessary arrangements to implement the outsourcing. Then we agree to collaborate, where we have all the work, all the process well structured and aligned. Then we assess the capacity, assess the capacity needs. So we will do the assessment and ensure that, for instance, just to give you an idea, in Mozambique, these companies are operating. They are all international. We would like to see some local companies grow from transporters to logistics service providers. So we assess the capacity, we see what we have in the market, and then number 4, we provide the support. And after the support is given, which takes, each of these processes takes time. It might take 6 months, 1 year, until we get to number 4. For instance, in Mozambique, we started back in 2014, and the first distribution happened in November 2015. So all this time was the discussion, was the strategy, was the designing of the process, was to ensure that we have all the necessary arrangements to actually implement. And then at last, we have to ensure that we assess the impact of our support to that particular country. So this is how we see the phases of engagement being laid out, and we are open for countries that are willing to implement this. We can get this contact from the private sector and actually go to those countries. As we all know, VillageReach has a good relationship with Minister of Health in the country where we operate. So we have experience dealing with this ministry, and we really want to ensure that the private sector is very active, especially in the distribution and warehousing of health commodities. And all these partnerships has been more evident and necessary, especially in the COVID situation, where we all had to work together to fight this pandemic. And we saw a lot of activity, a lot of action from the private sector, not only on the transportation side, but on the manufacturing of a lot of vaccines. All this has been, and transportation, the cold chain itself. So it has been really evident that the private and partnership relationship and collaboration is really mandatory to ensure that these solutions are scalable and sustainable. At last, this is how you can contact us if you want more details, if you want to actually have the support in any country. You can come and contact us. We will definitely assess and look at the possibilities of giving the support. And I'll stop from there. I'll take questions. Thank you.
Hello? Got some questions? We have a reasonable amount of time, guys, so get your thinking caps on, eh?
Yeah, Alvaro, thanks for that presentation. I wanted to ask, what challenges have you faced in the assess stage of your, of the stages that you go through, and not just the assess, but what other challenges have you, particularly for the assess and the evaluate, I believe, but also just generally speaking, interacting with them. What challenges do you face? Have you faced? Thanks.
Thank you. That's very interesting. I suppose to elaborate more on that, because it's really important to show that it's not a quick step. There is no magic stick for this. So there were a lot of challenges we faced, a lot, and both sides. The private sector on one side, as I was saying, they look at the payment terms and payment methodologies of the government with a lot of with a lot of concern. And also at the same time, we are talking about giving something that the Minister of Health considers sensitive and dangerous to manage to a private sector, with a lot of problems we have in those countries, thefts, damages, poor roads, rains. So we had to actually sit with these entities and explain that actually the private sector is more capable to do this than us. And we can look at the history. How have we done so far? Unfortunately, there were no comparison for private sector outsourcing to compare apples to apples. And one other major concern about the government is the price. They consider private sector very expensive. But against what? That's the problem. Against a very inefficient process. They don't measure. If you go to the Minister of Health and ask them, how much do you spend for your transportation in a year, in a month? Most of Minister of Health will not have that information. They don't know. They don't know because they use the same vehicle to take potatoes to the health facility, and they put medicines there. And they can leave vaccines because it's not their mandate. But when we combine all those supply chains into one, then we see efficiencies. So it was a lot of advocacy, evidence, and a lot of talking. As I was saying, the advocacy takes its time. But the phases after advocacy, it runs smoothly. But the advocacy itself, it's really difficult to convince not only one department. Sometimes you have to convince 3, 4 departments. And not only convince, because these people are getting per diem to distribute, to do the work. And now you're taking something out of them. So it's a lot of work, it's a lot of advocacy, it's a lot of discussions that needs to happen on the ground. And the management must also be very, very strong in pushing this forward. Otherwise, it's going to be very, very hard to implement. I don't know if I captured your question.
Any more questions, anybody? Same question.
Cheers, thanks. And I was going to ask another question, which is, what have been the benefits so far? I mean, for example, have governments realized improvement in security of medicines, better supply chain management, timely movement of goods? I mean, is there anything that you've quantified that you've got?
Thank you. Yes, we do have pre-indicated KPIs, which we measure them on a monthly basis. Although I must say that cost is still a challenge to actually say that it's cheaper or it's more efficient. But what we have on the ground so far is that we have a very reliable distribution process. On a monthly basis, every health facilities, I'm talking about 1,860 health facilities or more being visited on a monthly basis with all its needed medicines, including vaccines of COVID and all other immunization vaccines, okay, being delivered on a monthly basis. That's a big gain. Secondly, is that we have now the government managing the process. The government now realized that we're actually not losing by not doing the distribution, because they have to sit and actually ask difficult questions to the transporters and ensure that all the medicines, the quality of medicines at the health facility is captured, is controlled. So this is one big advantage. And also now we have health workers just taking care of patients, not taking care of logistics or supply chain, or the quality of cold chain that takes vaccines. It's all outsourced. We just demand quality. We are there sitting with the government to tell them what questions to ask to ensure that the process runs smoothly. So I will not be able to tell you all the difficulties we found along the way, but there were many difficulties. It's a process. It takes time. Sometimes, just to give you an idea, in the first province where we started, everybody was trained. Everything was running smoothly. When we realized now this province we can leave, so we can take our time and effort to our other province, the whole team has been changed. Completely all. The new director came and decided, I need a new team. So we have to go back and start training from the scratch, the new team, so they could actually manage. So there are a lot of difficulties, there are a lot of uncertainties through the implementation of all this system. It's not a magic stick, as I said, but it's a process. And when it's taken seriously, it works just perfectly. There are challenges, still a lot of them. But at least, as I was saying, the main gains, the main things that we can say we managed to achieve is the consistent distribution through the health, till the health facility. Exactly. And we have a system. We have a system where VillageReach can now say, okay, you guys do it. We have toolkits where they can go and consult whatever they want. Exactly.
Okay, guys, we've still got a couple of minutes. Anybody else with any questions? No? Everybody happy? Okay. Then it only remains for me to say thank you, Alvaro.
Thank you.
Thank you very much for the talk. It was quite interesting.
Thank you.